All right, here we go. All right, so we're looking at first the connective tissue coverings. All right, the first covering that we can pull up on any of the hearts is this thin layer. This is known as the epicardium. It is also known as the visceral pericardium. So you can see I can pull up just a little bit of tissue on these. It's really thin. It's like half the thickness of a sheet of paper. It is a combination of epithelial tissue and a little bit of adipose tissue. So this is known as layer-wise, it is the epicardium, and or it is known as the visceral pericardium. On the surface of that would then be serous fluid, and then I'd have the fibrous visceral or parietal portion of the pericardium over that, and that would make up my pericardial sac. So if I turn this heart over, again, my layers are going to be the epicardium right here, all right, because epi means upon. On the inside, I can pull up an equally thin layer, which is known as the endocardium. It lines the inside of the ventricles and the inside of the blood vessels and the atrium. And then everything else between these two layers is then referred to as the myocardium. All right, so I have an epicardium, I have the endocardium, and then I have the myocardium. So most of the heart tissue is going to be the myocardium. Chamber-wise, let me get a good one here. All right, so this guy's probably the best. All right, so chamber-wise, the two lower chambers are my ventricles, okay? They are the largest of the chambers. They're down near the apex or the pointed part of the heart. The other two chambers are the atrium. All right, if I peel this back, you can see the opening. This is the going to be my left atrium on this side, or sorry, right atrium on this side, and this will be the left atrium. So those are my two upper chambers. So right atrium, left atrium, right ventricle, left ventricle. So when you look at a heart, the first thing you should do is figure out which is your right side, which is your left side. All right, this heart is a little bit easier to see. I look at the walls of the ventricles. I look to see the thickness of this wall, compare it to the thickness of this wall. This wall is thinner, therefore this is the right ventricle. This wall is thicker, therefore that is going to be the left ventricle. The right ventricle pumps only to the lungs, so it's less thick than the left side, which pumps to the whole systemic system, to the whole body. All right, so right ventricle, left ventricle, that would make this my left atrium up there, and then the right atrium is up underneath, behind this structure here. All right, we talked about the auricles. All right, the auricles are the flaps. We see them on the anterior side of the heart. So this is then going to be the right auricle, the right flap right here. This is the left auricle right here. And the nickname for the auricles are the dog's ears. All right, and then if we open it, then inside that auricle will be the atrium. All right. Okay, looking at valves. All right, so on the next section here, we have the right AV valve. I will find the right AV valve on the right side of the heart. So first I have to figure out which is going to be my right ventricle. This is a right ventricle because it's thinner. So if I peel this back like this, you can see the cuffs of the valves. This is my right atrial ventricular valve, or my right AV valve. Structurally, it's known as the tricuspid valve because the tricuspid has three flaps on it. 1, 2, and I can actually see the three flaps on this particular valve. Most of the time we can't, all right? So it is the right AV valve or the tricuspid valve. On the other side, on the left side, this is my left AV valve or my left atrial ventricular valve. The other name for it structurally is the bicuspid valve because there's two flaps, bicuspid. It has one more name, and that is the mitral valve. All right, so mitral valve, if somebody has a mitral valve prolapse, it means this valve does not close properly. You do need to know tricuspid, bicuspid. And the way I tell students to learn it is The tricuspid is on the right side. You ride a tricycle before you ride a bicycle. So tri is before bi. Tri is on the right, bi is on the left. Okay? In addition, my other two valves that I have, this one right here is going to be my aortic semilunar. This is my aorta. This is the ascending portion of my aorta right here. So this is the aortic semilunar valves. They're little cup-shaped. There's 3 of them in the aorta right there. Let's see, this one we can see as well. All right, so this is my aorta right here. This is the aortic semilunar valve right there. So that's one of the 3 cusps that we have. The rest have been removed. All right, and then on the anterior side of the heart, all right, I will find my pulmonary trunk. All right, the pulmonary trunk, inside of the pulmonary trunk, and you may not be able to see this, you might just have to believe me, is the pulmonary semilunar valves. Okay, so I have 2 semilunar valves, one in the pulmonary trunk, one in the aorta. I have 2 AV valves, a right AV valve and a left AV valve. All right, so in addition to that, looking at other blood vessels associated with the heart, we've got, this is my aorta right here. This is the aortic arch coming off. That first blood vessel that comes off of the aortic arch is going to be my brachiocephalic artery. Arteries always stay open, so you can see these lumens are open. That way, because of the very thick muscular wall, you know that this is a artery which carries blood away from the heart because that lumen stays open. All right, and the same with the pulmonary trunk. All right, we can see that the pulmonary trunk, the lumen is open, so we know that that also is an artery and it carries blood away. Now, I don't know that I have, oh, right here, maybe. Okay, so what we're looking now for is the superior vena cava and the inferior vena cava. All right, those are what is going to return blood to this right atrium. All right, this is going to be the opening. This is a quadruped. These are deer hearts. So therefore, they actually, instead of having a superior vena cava and an inferior vena cava, it is an anterior and posterior vena cava. So this would be the opening that I would have for that superior vena cava right there. Vena cavas always collapse. They're very thin-walled, therefore those openings will not stay open. They will collapse down as soon as we stop pulling on them. So superior vena cava brings blood down from the upper portion of the body into the right atrium. The inferior vena cava brings it from the inferior portion of the body to that right atrium. And then my third vessel that will bring blood into that right atrium is right here. All right, this is my coronary sinus. The coronary sinus is where all the blood collects from the heart. It drains the heart itself. The coronary sinus is located in the coronary sulcus. If you remember the word sulcus, it means a groove. It runs all the way around the base of the heart. And though it's where all the blood from the heart drains up from the anterior and posterior through the venous side, empties into the great cardiac vein, and then the great cardiac vein empties into this coronary sinus, and that will then empty into that right atrium. So that takes care of all of those blood vessels. All right. Okay, other structures that we need to look at on the heart. All right, we looked at these AV valves right here. The strings that attach the AV valve to these are the papillary muscles right here. Papillary muscles are attached to the wall of the heart. Then from the papillary muscles come these chordae tendineae, or cords of tendon. Those chordae tendineae attach then to the cusps of my valves. All right, so papillary muscle, chordae tendineae, cusp of the AV valves. In addition, I'm going to look to find trabecular carnae. Do you remember trabeculae means beam or strut? So what I will find that inside the wall of the heart, I will find an additional muscle that attaches from the ventricular septum to the wall of the heart, and that provides additional strength and structure to the heart. So these are going to be, this is a trabecular carinae right here. All right, then I'm pulling here down inside the heart itself. These will also be trabecular carinae. So we find trabecular carinae down in the ventricles of the heart. In the atrium, I will find what are referred to as the pectinate muscles. So pectinate muscles are found in the atrium. All right, they look sort of like your pectoralis major, the way that the fibers run. That's where it gets that name from. All right, so the pectinate muscles we find in the atrium. The trabecular carinae we find in the ventricles. In addition to that, we've got the interventricular septum. Okay, this interventricular septum is the wall between the right ventricle and the left ventricle. I have a interatrial septum, but generally we don't test on it because you can't see it because the blood vessels are in the way. But it would be the same wall that would be between that right atrium and that left atrium. Other than that, we need the apex. The apex is the pointed part of the heart, so it's down here at the tip of the ventricles, and then up at the upper end, upper surface, is my base of the heart. The base of the heart is where all great vessels enter and leave the heart. So at the base of the heart, pulmonary trunk leaves, aorta leaves, superior vena cava, inferior vena cava, coronary sinus enter the heart.